Olympics, that remains to be seen, but we do know, Darnay, that Japanese officials walked back some earlier comments suggesting that the games might be postponed. They say at this point everything will go on as planned. Stay tuned to all of that. Dr. Georgine Nanos is an expert in epidemiology. There are so many medical questions. We invited her to stop by and talk to us. And what was interesting is when she showed up just a short time ago, you actually have a coronavirus test.
I do. Yes. Would you like to see
Yeah, because we're curious to see what it looks like.
It's just a standard viral test. It's made. This one's made by LabCorp.
A swab.
It's a swab. It can go in the nose or the mouth or both. It's really just a standard viral swab. It's not anything that's super complicated to use.
But there was a lack of these, and it was interesting because it was widely talked about that the lack of availability of these tests initially slowed the response here in the States and worldwide.
And I think it did. And so, and even now, we don't have a lot of these available. So there isn't a lot of, I don't recommend that everyone call up their primary care doctors or their ERs and demand to get a test. And, you know, the president saying that anyone who wants a test can get a test is not really necessarily true at this moment in time. Maybe in a few days or weeks, but right now we don't have a lot of these, and it's not necessarily useful to get tested if you're a low-risk individual. You know, in medicine we have lots of tests for everything. We have to think about why we're doing those tests. Is it going to change the outcome of how we're going to end up treating somebody? That's ultimately what really matters, right? Not the test itself, but what we're going to do with that information. So if you're feeling ill and you're a low-risk individual, my recommendation is always going to be to stay home and isolate yourself and protect yourself and other people around you from catching the virus.
Last question I have before we run out of time. We always think of a physician as you guys being the smartest person in the room, but have you all had to basically learn as well? I mean, there are a lot of mixed messages. There's CDC, but there's not one unifying message. You guys had to just figure it out, how to treat this, how to look for it.
It's honestly a lot of the physician groups and the physicians I know feel like there's a lot of information out there, yes, but we know how to treat viruses. It's just the problem here is we don't have a treatment or a vaccine, and our elderly populations are very much at risk and vulnerable. And so a lot of what we're seeing is just an overabundance of caution to really protect those populations, and it is feeling extreme and difficult to kind of swallow for all of us as a country, but it's what's necessary to kind of contain it right now so it doesn't become a bigger problem and overwhelm our health system, which is already kind of at its brink in terms of managing patients with complicated illnesses from the flu. So we just have to be careful that it doesn't get worse.
Okay. Dr. Nanos, thanks very much for stopping by.
You're welcome.
Appreciate it. Nice insights.